My name's Don Lalonde. I'm a professor of plastic surgery at Dalhousie University in St. John, New Brunswick in Canada. I started practice in 1984 and just retired this month. And in fact, I saw my last patient 5 days ago.
Yeah, WALANT really started out of necessity in Canada because we just didn't have enough anesthesiologists. And so we could operate, but under local anesthesia in the main operating room or in minor procedure rooms. So in the beginning, I used a tourniquet. In the first 5 years, I did carpal tunnels and trigger fingers with a tourniquet. It was torture test, 5 minutes of terrible pain. If you've ever had a tourniquet, you should put it on your own arm to see that. And then I've had other good people saying, you know what, we're using epinephrine in the hand. Winston Parkhill in Halifax and other people. So then we moved to epinephrine in the hand and in the fingers, which meant, hey, we didn't need to be in the main operating room anymore. We could move these with our skin cancers into minor procedure rooms. Way faster turnover, way less hassle getting outside the main operating room, same infection rate. I think that WALANT is really going to change a lot of what we do. I think a lot of the surgery that we now do in the main operating room will move to minor procedure rooms, either in hospitals or surgery centers or offices, and it's expanding incredibly rapidly. I looked on PubMed this morning and just put in the word WALANT. 330 publications since 2013. 330 papers on WALANT, and from all over the world. So it has grown very, very rapidly because it costs way less, it's much more environmentally friendly, it's much safer for patients. I can think of some moments that really made a difference. September 2001, 20 surgeons had both hands injected in 3 places. 2 in the finger, 1 in the hand, with lidocaine with epinephrine, to prove that phentolamine reliably reverses epinephrine vasoconstriction in the finger. I mean, to have 20 hand surgeons have their hands injected 6 times, I think that was a huge moment in history in my mind. I think that all tendon surgery, whether it's tendon repair or tendon grafting or tenolysis or tendon transfer, will be done with WALANT. And with tendon transfers, you're going to get the tension right because you can actually see problems when the patient flexes and extends during the surgery. I think that's one thing that's going to change in the future. I really hope in the future that a lot of the hand surgery will move out of full sterility in the main operating room to minor procedure rooms. I hope that we have more and more evidence-based sterility research to prove that it's safe, to add to the large body of knowledge that we already have provided with research to prove that it's safe, so that we can quit these mountains of waste. Not only money, but landfills and water pollution and all the things that happen. I think probably one of the most impactful moments when Peter Stern came to me at one of the hand meetings and said, Don, I think WALANT has gone over the tipping point. People get it. And I thought, wow, because I have so much respect for Peter Stern, as do most hand surgeons. And I think another moment that was a key moment for me was another one of my mentors, Peter Amadio. He got up at the ASSH meeting and said, WALANT is the right way to do this. And for me, that was like, whoa, massive. If I could talk to all the young hand surgeons, I'd say a few things. Whatever you do, make it about the patient. Don't ever do an operation on a patient that you would never have on yourself. For a fingertip, for example, a lot of people are doing fancy flaps, and I'll bet most hand surgeons, if they had a fingertip injury, would just let it heal.
And if they needed reconstruction, they get it later. If you give patients a good experience, your life will be much more enjoyable. You're not going to endure your work, you're going to enjoy your work. Just like the patient doesn't endure the surgery, they enjoy the surgery. And coming home after a day of joyful work is very helpful.